Who needs a baby shower when you're dealing with preeclampsia? If you or possibly your baby can't survive because of this fatal condition. Birthing while Black should not be a death sentence, yet it is for too many women. Here's a reality check. Black mothers die more from this blank than anything else. Joining me today to fill in the blank and share what you need to know about Black women's heart health on the maternal continuum and beyond is cardiologist Dr. Rachel Bond. So stay tuned. Stop for a moment. Share this with every sister you know on the maternal continuum or not. Had babies, just kicking it, post babies, prepare wherever you are on the continuum. Sister to sister, you need this vital information. But first, let me welcome you to Detox Living, where we bring you truths, tips, and testimonials to power your toxic-free living. I'm your host, Coach Gessie. I'm a fibroid survivor turned health activist and founder of thedetoxnow.com, a holistic health provider of the education and supplements that help combat obesity, chronic disease, reproductive health issues, and other health issues that lead to lower life expectancy rates. Join me today in welcoming Dr. Rachel Bond. Hi, sis. Hi.
Good to see you.
Good to see you. We've been trying to get this combo for a while, but we got it.
Finally.
Well, I started off because I just took my BP, and we're going to talk about, just how critical it is to self-monitor your blood pressure every day, and to know your baseline, know what you're dealing with, whether you're on the maternal continuum or not, or beyond, right? But let's start off with some of the hot topics, the things that we've been seeing and addressing. And first of all, though, they need to know who you are, right? So I always love to start each episode with, who is Dr. Rachel Bond and how did you get to do what you do today?
Absolutely. So first of all, thank you so much for this opportunity. I would say that this is my passion as a cardiologist, and I'm going to get to why as a cardiologist, Black maternal health and Black women's health in general is so near and dear to my heart. But I am the first medical doctor in my family.
Wow.
I'm a doctor at a very, very young age, and then really wanted to devote my life to cardiology because it's the leading cause of death in the United States, just being largely preventable. So we could prevent it 80% of the time. And I knew that for me, my passion was to focus in on how can I get the messaging out there to make sure people understood the tools of how to actually prevent cardiovascular disease. You mentioned one singular one, which is checking your blood pressure, making sure you know those numbers. And we can talk a little bit about what those important numbers are. But for me as a cardiologist, my focus is prevention. And I also specialize in women's cardiovascular health, and more in particular, women of color, because we know that there are lots and lots of disparities, not during pregnancy, but really across that whole spectrum from when they're girls and more importantly, as they age. And as a result of that, that's where I devoted most of my career to. So I'm looking forward to this conversation.
Well, I love how, early on, how old were you when you said early on?
Probably when I first could begin speaking.
Wow. So you said, I want to be a doctor. That's number one. Right? You were like, I want to, so my daughter's 3 and my daughter's 12. And at 3, she knew she wanted to be an actress, right? So I totally get it. That I always say, remember, I think we get lost in self-doubt. We disconnect from the things that kind of we were wired to do from early age, right? From birth. And self-doubt and other people's opinions and everything start to kind of pull us away and even diminish the value of what we're really passionate about. But kudos to you that it was a spark. And And you were like, look, I want to play the big game. That means that I want to deal with the thing that is killing us most, right? Which is heart health, right? And has the most opportunity for change because there's 80% of it is preventable. Mm-hmm. That's what you call a win-win. You're an A personality, aren't you, Dr. Rachel?
I would say probably yes.
Yeah, I mean, you're like, listen, I want to win. I want to win. But I love it that you want to win for in the way of arming us with prevention, yes, because there's so much we have in our power to do, right? That's what I love. And you know, at the Detox Now, that's what we focus on, is arming people with, yes, you know, we believe health is integrative, meaning you partner with your providers, your medical providers, but you also have to be equipped with what is in my hands to do, right? What do I need to focus? What's my nutrition plan? What's my supplement plan? What's my medication? Like, what do I need to do? Everything. So I love that. And then the fact that there are disparities where not only is it the number one killer, but then it even more disproportionately affects people of color and then women on top of that, right? Women of color, Black women, even more. So, you know, there's so much opportunity there. So as you mentioned, Black women, the statistics when it comes to maternal health, it's actually nationally 3 to 4 times the national average that Black women die in or immediate, you know, after childbirth, you know, due to complications. And in some cities, like in New York, it's up to 12 times in my city, right? Which is despicable, right? It is absolutely disgusting, especially when so much of it is preventable, right? And you know, I think the big thing is knowing this as a Black Latinx female. Look, how do you bring comfort to your patients who are pregnant with pre-existing heart conditions and beyond? Like, how do you set them up for success?
Yeah, no, that's a great question, because I think even when it comes to the portrayal in the media, oftentimes there's lots of stories of those disasters, right? Mm-hmm. Those tragedies that we often see. And as you very nicely mentioned, they are largely preventable. Mm-hmm. Why, again, myself as a cardiologist is so intimately involved in maternal health, I think it's important for your viewers to understand that the leading cause of death during pregnancy is cardiovascular disease. So that includes heart failure, where you have a weakened heart muscle. That could include that could include stroke.
But you just fell out. So let's make sure we say that, because I want to make sure they hear it. Because all of the leading causes are connected to cardiovascular issues. So the number one you said was cardiovascular issues that lead to, you know, heart attack.
That could lead to heart attack. Mm-hmm. That could lead to stroke. That could lead to heart failure, where you have a weakened heart muscle. And also, we know during pregnancy, lots of elevated blood pressure issues can also impact the pregnancy, but also impact one's risk of heart disease up to 20 years after they delivered. So
say that again. Say that again. They need to hear that. So, you know, I was reading something that talked about how, you know, pregnancy is such a high risk factor in terms of how it impacts our bodies, right? And what you just said was that pregnancy can affect your heart risk factors up to 20 years after birth.
After birth, exactly. And that's if you've had conditions like preeclampsia, where your blood pressure becomes severely elevated, and it could affect some of the other organs in your body. If you've had gestational diabetes, or even have premature labor, or have a child smaller than recommended or gestational age, those are all risk factors that could unfortunately linger on and lead to heart problems in the future. And the beauty of knowing if you've had these risk factors, and this is what I tell my patients, is that some of these risk factors are not things that we could avoid. Yes, there are things that we can do to optimize our health. And the first thing is making sure that we're getting preconception counseling, that we know before we're thinking about having a child, what our numbers look like, what our blood pressure looks like, and our blood sugar and our cholesterol, and are we eating the foods we should be eating, and are we exercising the amount of exercise we should be doing. And if you know all of that, it does lead to a less of likelihood that you're going to have complications. But the fact of the matter is that the statistics right now with Black women, 3 to 4 times the rate as compared to their white female counterparts, largely has more to do with the system that they're going through, right? Those sort of historical trauma leading to contemporary trauma.
It's not race, it's racism.
Absolutely.
Right.
Absolutely. And I think it's important that when I'm speaking to patients that they understand that this is a system that was built against them, but you have the tools that you can kind of fuel and understand what your risk factors are and the signs and symptoms to look out for, and then advocate for yourself. So that advocacy piece is the most important aspect. And then the other piece of advocacy that's important is finding a healthcare professional or multiple healthcare professionals.
Team. We call it a team, your village.
Your village, exactly. And that village, yes, should be the healthcare professionals, but it could also be your family, your friends. That
doula, health coach. Hello. Right.
Absolutely. The doula, health coach, etc., that come with you to the visit that are your eyes and ears as well. Because that's how we're going to get through the system that absolutely needs to be changed.
I love, what you recommended, because one of the things I say to our clients all the time is let's frame it in the conversation up front.
Yeah.
We know that the system is broken, right? So, but this is how we are going to, with intention, plan and navigate, right? Like one of the questions we tell our clients to ask is, because of how racism is a factor in the outcomes, how are we planning? How are we planning for how it can show up in this situation, right? And, I know people who they love their specific OB, right? They have a great OB, but sometimes that OB may not be the person who delivers you. There are other team members. There are other, what are the ways in which, what are the support systems that you're going to place in your village, in your circle, that are going to help to provide for those potential gaps, provide for those potential breakdowns? Like the advocacy piece is so huge. So, and I always say, if a doctor has a problem with that, then right there, they're just telling you they're not your doctor.
Exactly.
Right? So I love that. We talked about that funny post, not funny. It was sad, right? Where socialite, Jasmine Cheeves, spoke about how she was like, I can't go to the doctor. They said that something was swollen and I might have preeclampsia, but I can't go to the doctor because they might keep me overnight and I don't want to miss my baby shower. And, we said we would speak about it because it's about early intervention, right? What could that mean? I mean, thankfully she did have her baby. She's healthy, right? But what could that mean? What could that look like?
Absolutely. No, thankfully the ending for her was a positive one, but oftentimes it's not. As you mentioned, that early intervention piece is so important. And this is where fueling ourselves from a health literacy perspective is important too. Because perhaps if she had the opportunity to be explained by her healthcare professional what preeclampsia means, what the severity of it could look like, perhaps she would have had a different response to it. Because I have to imagine, and again, I was not involved in her care, but I would have to imagine that had she known the possible risks that come with it, she may have chosen a different situation. And it did end well for her. But as noted, many a times when it comes to elevated blood pressure and preeclampsia, it's not always the case. And the moment that blood pressure is elevated, that moment you have the signs of swelling in your legs, or the swelling in your face, the swelling in your hands that don't go away, the belly discomfort that doesn't go away, that headache that doesn't go away.
So these are the symptoms. These are the symptoms.
Preeclampsia, then you have to make sure you speak to your obstetrician and go to the emergency room, right, to get treated
right away.
And seek guidance.
So a couple of things. One is not knowing the severity, not knowing, that there was an opportunity there for educating her and knowing her, wait a minute, this actually could be life and death. Like this is something we need to take very seriously, because if it's ignored, it could lead to, fatalities or complications with you and the baby. Right. And we're saying that it was a positive outcome, but she now faces, if she was dealing with preeclampsia at the beginnings of it, she's at risk for it 20 years now. Did I hear you correct? Is that correct?
So preeclampsia, as related to the other risk factors that could occur during pregnancy, also can increase your risk of not
having. It
could increase your risk, right? It's not a guarantee, but it increases risk of heart disease up to 20 years after. The other thing that's important to know about preeclampsia is that if it occurs with one pregnancy, it's more likely to occur with another. And the beauty about preeclampsia now is that we are studying it a lot more because we see it becoming more and more common. Right. And I think it was there before, it just was undiagnosed is probably a better way to state that. But as a result of that, we do have some management recommendations that could include taking a baby aspirin during your pregnancy if it's suggested by a professional. But that also includes the basic things like checking your blood pressure, making you physically active, and you're eating a heart healthy diet. All of those potentially prevent it and avoid it. The first step, though, is speaking to your doctor. What is my risk of preeclampsia? If my risk is high, what can I do to lower that risk? That would be the next question I would suggest.
You know, I would even say, and tell me if you think I'm right, but I would even take it a step back. So I don't know if you know, but I've been coaching Deion Sanders' daughter. She's dealing with a pregnancy, a miracle baby pregnancy with fibroids. And thankfully, you know, she's had a cerclage. She's doing really well. And I hit her up yesterday. I was like, hey, you know, what has your BP been? And she says, it's been good when I've been going to the doctor. I said, you know what? Let's get you a BP monitor at home because I don't think that's enough. I'd like to have to hear about you monitoring your BP at home because I don't want to wait till I get to the doctor to find out that I've been trending elevated, that things have been trending because then I can come to the doctor and say, hey, you know what? Yeah, because sometimes if your pressure is a little elevated, it could be like you were rushing, it's in the moment, right? But if I have a log sheet now and I've been taking it at home and these have been my numbers, now I'm equipped to help make a better, more informed decision with the physician, right?
Absolutely.
And so now I feel like first of all, every Black woman should have a heart monitor. And I'm not going to show you the brand. I love this just because I'm not promoting any specific brand, but this is so easy to do. I just took mine right before I started today. It was 127 over, what was it? 127 over, I want to say 63. What was it? Oh, don't start on me. 127 over 73, excuse me, which was fine, right? But that was after I was rushing upstairs, coming, you know, like I was trying to set up and everything. But the point is that if I don't know what my baseline is at home, right? So because of the fact that one of the biggest ways that, what's the statistics? More than 50% of Black women have high blood pressure, ages 20 and up, and don't know it, right? Exactly. You know, our friends at Release the Pressure have been really huge at, the coalition has been really focused on getting that information out because the biggest part is, and don't know it, right? And you don't know it because you're waiting to, when I went for my annual, they said my blood pressure was fine. What about the whole 364 other days of the year? Right?
Exactly.
And because it's a silent killer, there are no symptoms until it is too high. Right? I had unchecked blood pressure during the pandemic where we weren't going to the doctor during that time because it was so bad. Guess what? I actually, because of risk factors connected to polycystic kidney disease, developed a brain aneurysm. Right? So I cannot stress enough. This was like 67, maybe $80 less, maybe less. Easy to press the button. It's something they connect with your phone now where you have the app and it logs it. You can take a screenshot of it, text it, send an email, bring it to your doctor. But it is so vital for you to know, like to take a 2-week time. My understanding, you take a 2-week time frame, measure it, see how it is. Okay, boom. Now you know your baseline. Maybe then do it again next month. It doesn't mean you have to measure it every single day, but at least get yourself a baseline. Give me your thoughts on that.
Yeah. Yes. So what you're referring to is a home blood pressure machine. And we encourage everyone, irrespective of age, gender, race, to get a home blood pressure machine.
Everybody.
So you very nicely stated when it comes to Black women in particular, it's actually close to 60%. So
that close to 60 number has gone up because they said more than 50. So they didn't, wow. Thank you for letting us know.
That's okay. So closer to 60% of Black women have some form of cardiovascular disease and die from it. And largely it's from high blood pressure. as you said, is a silent killer. There are websites. One is validatebp.org.
Validatebp.org, right. Where you can...
And that gives you the opportunity to know which machines have been validated. Yes. And that's really important because not all machines are equal, right? We want to make sure that there's accuracy to it.
Right.
What I encourage my patients to do, though, is bring their machine into the physician or clinician's office so we can confirm, even though it's a validated machine, that it's working accurately. The other piece of that is that the doctor and the clinician will probably walk you through the best way to get your blood pressure checked, because as you said, checking it after rushing up the stairs.
There's a whole protocol. Yeah. In fact, we have a free heart health kit actually, that we created with, not created, we actually pulled together in partnership with the American Medical Association, that has all the sit properly in the chair, right, with your feet flat on the floor. Make sure you empty your bladder or your bowels. Have your left arm above the crease extended. Make sure that it's at your heart level.
Exactly.
No exercising or drinking any coffee, within 30 minutes before. Have I missed anything?
No, that was perfect. Again, like you said, back supported, and just make sure you're doing those things. But the beauty of blood pressure is that at any given moment or any given second, your pressure's different.
That's right.
So this, take an average. And I do think it's important for the viewers to know normal blood pressure is less than 120/80, but everyone's target is different, right? Based on health condition. So that's why it's important to speak to your healthcare professional about what your target blood pressure should be.
Awesome. And I think that when it comes to monitoring it, to know what your baseline is in conversation, because you may require for most people, they can change it with dietary changes, with lifestyle changes, with exercise, right? In a condition like mine, because of chronic kidney disease, there's no more lifestyle. I've done everything I can with lifestyle, but I have to take blood pressure medication in order to keep it at a certain number, because it's very vital to my kidney health, right? And the kidney disease that I have, literally, it has kidneys, cysts all over the kidneys. So it keeps it at a certain level of function, right? And he's like, I can't tell you to not smoke, can't drink, like everything, you're taking supplements, you do all of that. So now we have to intervene with medication. So whatever your specific case is, you need to know so that you can make sure that pressure is regulated. You don't go by, I feel fine, because talk about that, Dr. Rachel.
Absolutely. So often people feel fine, especially when it comes to blood pressure. As you said, it's a silent killer. So that means that by the time the blood pressure is so high, that's when you're going to feel it, but you may die from that. So knowing these numbers as early as possible, the same way knowing your cholesterol and your blood sugar is important too, because a lot of times you're not going to feel the side effects of high cholesterol. You're not going to feel the symptoms and side effects of high blood sugar until it
becomes a problem. Yeah,
exactly.
So how does that now, what's the overlay in terms of the heightened level of severity or how much more important it is for a pregnant woman to be monitoring her pressure more regularly?
So I would say that every pregnancy is different, right? And that's where it's really important for you to know, well, am I at risk of having high blood pressure during my pregnancy? And if the answer is yes, then you should be checking your blood pressure regularly. We know that during the progression of the pregnancy, it becomes a lot more important, right? So as you get closer to that third trimester, and more importantly, that laboring and delivering phase, that's when your body is making all of these changes. The reason why many of these issues occur during pregnancy is because we think about pregnancy as nature's first stress test. Your heart rate's increasing, your volume's increasing by 50%.
Wow, that makes sense.
Blood pressure, right? That's going to affect all of these little vital signs. And as a result of that, as the pregnancy progresses and more volume increases and your heart rate increases more, there's a possibility that you are at a higher risk of these complications. But again, not everyone is. And this is why knowing what your risk factors are, one risk factor that I think many people often don't think about is family history.
Yeah.
Right. knowing if our parents, our mom and dad, or anyone that was a first degree relative, including our siblings, did they have any cardiac issues or did they have any complications during their pregnancy in the setting of preeclampsia or other possible adverse pregnancy outcomes? And if the answer is yes, you need to let your healthcare professional know that if they're not asking that question, because that does change what your individual risk looks like as well.
No, it's interesting because Taj from SWV has shared her testimony many times with us. And she talked about how I never had blood pressure issues, never had a history, nothing until pregnancy.
Yes.
And then it literally changed the rest of her life, right? So I think the argument can be made that even if you don't have a history or risk factors that are present, it's still beneficial on a prevention side for you to be monitoring, because what if you're the first one? You know what I mean? Like, there's no harm in you being on top of your blood pressure so that you can be aware and have accurate information, right?
Absolutely. I agree. And oftentimes, when we think about risk factors, it's important to highlight that the Black race, it is a risk factor. But as you pointed to, it's more of the social,
right?
The
it's social construct. Mm-hmm.
The contemporary trauma and the ongoing.
That's what I always say. Listen, the fact we come to the table with heightened, they say, why are we disproportionately affected by it? Well, because of the trauma of racism and how it affects every area of our lives. I mean, like, hello.
Yeah.
Right. which brings me to my next point about stress. I mean, stress is literally killing us. Right. Yeah. And let's be clear. We're talking about the fight or flight response that our body it generates, right? It triggers when our cortisol hormones they really go into, they fuel our bodies with an uptick in cortisol hormones because we're in a fight or flight mode, right? And fight or flight mode is something that as Black people, we unfortunately are always faced with having to manage, right? Whether it's microaggressions at work, or it's, blatant racism, or it's, feelings of, not being enough, or, being dismissed, your pain being dismissed, not being heard, not being, prioritized, all the things that we talk about, right? So with that, for us, that's why we preach prevention, because we say, listen, the best thing, radical self-care is my best weapon.
Yes.
Right? Because if I'm not proactive about my health, then I'm already in a place where I have to be reactive, right? So I have to take the offense. They always say the best defense is a powerful offense, right? So my question for you is, what do you suggest? How do you support your patients around that, around stress management and, how to assess and navigate related to stress and its impact in their health, especially with heart health?
Yeah, no, that's a great question. And I often tell patients that everyone encounters stress. It's a matter of how we, in a healthy way, cope with it, right? So we have to figure out how to cope with it in a healthy way where it's not going to impact our life. If we're consistently in a stress fight or flight mode, you could imagine what that's doing from a cardiovascular perspective, because like you said, that cortisol is being released, but also our inflammatory markers are being released, and all of that can predispose you to early onset of heart issues as well as cognitive issues too. So
that's right. Neurological function, excuse me.
Exactly. So thinking about what can I do that is going to help me alleviate that degree of stress. And a big part of that for us as Black women is understanding that we have to put ourselves first, right?
Yes.
We say, well, yes, I often am the backbone of my entire family. Perhaps even the way the structure is at work, I'm probably going to be the backbone of that too. But understanding that we have to prioritize our health, give ourselves even one day during the week for self-care, where we close ourselves off to the rest of the world and focus in on what we can do to remove that extra stress and that burden, that can make a significant impact. But then also being mindful of the fact that some of these stressors, like you mentioned, the microaggressions and things of that nature, those are out of our control. But what is in our control is how we react to it.
Yes.
And not using that to necessarily get to us, and figuring out the understanding that that person who's providing that microaggression to me, probably has some hatred within their own self. That to me is a better approach than internalizing it, right?
It's their problem.
It's their problem.
Meaning they're the one that has a problem and they're trying to put it on me.
Exactly. And I'm just not gonna allow that. And that approach is one way to achieve a healthy way to cope with these ongoing stressors.
How do you feel about, we talked about this in my last interview, which was talking about how one of the things, especially as people of color, we need to focus on is building up our parasympathetic nervous system, right? Because the sympathetic nervous system is the fight or flight mode, right? Which is our natural trigger in which it's always being triggered in, as we just talked about. But the parasympathetic nervous system, which is really our ability to rest and digest, it needs to be, it's like it's been dominated by the sympathetic nervous system. That's like, oh, you got you in a headlock. You can't rest. You can't digest because I'm in control. Right. Exactly. So, there are things that you can do with brain exercises and, everything from, proper breathing is a big thing, right? Like the 4-7-8, breathing and they talk about how mindfulness in terms of, and not something that's just like, yes, there's vacations, but there's things that you have to do throughout the day. Yeah. Right. Like, I see a functional neurologist and it's like one of the things they talk about is every 2 hours or so, you need to stop and, get up and walk away, like just get up and walk away and do some of your breathing exercise. What are your thoughts on all that?
No, I'm a big proponent for that mindfulness. There's actually lots of data from a cardiovascular perspective. The American Heart Association, as an example, where I volunteer a lot of my time, has actually published several papers on the fact that meditation, mindfulness can decrease, yes, your stress, but also your risk of cardiovascular disease. And I think that's so impactful.
Yeah. I think that weaving it as a tool that we use throughout the day, right? I often use the example of the pressure cooker, blood pressure cooker. Got it. The pressure cooker, right? If it didn't have a release valve,
yes, goodness,
right, it would explode.
Exactly.
Right. So it's like we have to make sure that we have a constant release valve. Yeah. Literally, right? And one of the things, the vagus nerve, which really helps to steer and control the parasympathetic nervous system, is triggered by cold water on your face. Mm-hmm. That's one thing that you can do throughout the day. Like in the morning, before you go to bed, really, really cold water triggers your parasympathetic nervous system. And singing loudly, literally, like, cause it's your vocal cords, mm-hmm. helps to gargling loud, literally in the, maybe in the morning before you go to bed, maybe in the middle after. It doesn't change anything you have to do. You can go to the bathroom and literally gargle. And it literally, and when I tell you what it's like doing, is like doing physical therapy for your nervous system. Exactly. Because like you said, stress is not going to go away. And meaning there are things we can control. There are things that we can reduce. There are things that we can say, you know what, toxic relationship, no more. If it ain't blessing me, I don't have time for it, right? We could do those things. Exactly. But then there are things that are just going to be present, right? And we have to increase our body's ability to manage it. So the mindfulness piece, 5 minutes of just silence, huge. Just break away, right? I know it feels like a lot, but it's worth it because it equips your body to handle it better. Okay. So as a cardiologist, yes. What is one thing you would recommend Black women stop doing to change their lifestyle for the better, or start? Stop or start?
Well, I kind of alluded to that. I think prioritizing our health is what we should start doing. Oftentimes it's not being done. And perhaps the stop piece is the same, which is to place ourselves at the bottom of that totem pole, because a lot of times finding the time to go to the healthcare professional and get your numbers checked, finding the time to do that 150 minutes of some form of physical activity per week, finding the time to make that healthy meal and make sure that you are necessarily focusing in on what are the things that are impacting your overall health is actually going to lead to the most preventable part of it. Because again, heart disease, either with pregnancy or without pregnancy, is preventable 80% of the time. So you have that opportunity and the tools to actually prevent it. It's just a matter of prioritizing your health. So I would say that the to do is put ourselves at the very top. And then
I'm gonna press you a little bit more, because I know you love the win-win. The win-win is it's gonna give me the best bang for my buck,
absolutely.
right? So if I had to narrow it down to a practice, right, that is a way of prioritizing myself, right? What's one thing that if I start doing it, it will help me prioritize my heart health?
Well, the first thing is understanding what your actual numbers mean, right?
So monitoring your numbers, be educated about them first
means, but understanding what the goals are. What's normal? What should normal blood pressure look like? What should my cholesterol be? And again, understand that normal to one person may not necessarily be normal to another.
Conversation with your physician. So what's my normal? What should my number be? Let's get that information first.
Exactly. Okay. And I think starting off there, then once we know what our normal should be, is asking the question, well, what can I do to prevent my risks? And largely, the majority of these situations are preventable through lifestyle measures. So finding that time to do that physical activity, and that could be in the form of even walking, right? Or maybe if we're in an urban community, deciding if we're using public transportation to get off a stop earlier, so we force ourselves to walk. It's finding that time to add in that extra form of physical activity, and then finding that time to really figure out from a nutritional perspective, what can I do so I don't have to run to get a meal outside or do takeout or do DoorDash or Uber, right?
Processed foods and things that can elevate my risks.
Absolutely. What can I do to make sure that I have the time and I know, more importantly, the foods that would be ideal for my individual health? Because everyone's health is very different.
So number one is, let's find out what your numbers should be, right? Just because 120/80 is a general baseline, but speaking to your physician about, given your history, everything going on in your life, your body, what should your number be? And then finding out what your number is, because the other thing is a lot of people are like, but I'm fine, right? I'm fine. Nothing's wrong. Yeah, but if you actually know what your numbers are, if you're monitoring your numbers at home, you're going to find out, wait a minute, there's a trend here. Now I actually need to take a look, because I think one of the biggest thing is the ignorance. The quickest way clients start texting or emailing me or whatever, they're like, wait a minute, my number is something wrong. Like, yeah, okay, so what is your doctor saying to do? Let's look at the plans, but you thought everything was fine all this time because you didn't think you were at risk.
Exactly.
Right? Well, the fact that you are a person of color, let's just start there. I always say to people, you as a person of color, you're vitamin D deficient. Unless you're taking supplementation and you live in the Caribbean, you are vitamin D deficient. I'm probably 99.9% right? Just because your melanin blocks the absorption of the sun. So what are we going to do about it? Let's get your actual number. Let's find it out. Let's get a plan for what you should be doing, because that puts you at risk for cardiovascular issues, right? Immune issues, reproductive issues, a lot of issues connected to your vitamin D deficiency. Okay. So I'm looking at time. Oh, this is good conversation though. Thank you. All right. So the work you are doing for cardiovascular health is birthing spaces. In birthing spaces is impressive. What does it feel like making groundbreaking strides and intersecting two high-risk health concerns, especially for Black women? So the birthing and the heart health.
Yeah, no, I'm really fortunate with many of these cardiovascular societies that I volunteer with. I'll just name two. One being the Association of Black Cardiologists. We've implemented a campaign called We Are the Faces of Black Maternal Health. The purpose of the campaign is to get the messaging out there that Black women are dying at these disproportionate rates, but give the women the tools to figure out what they can do to decrease those statistics. And I would encourage everyone to go to wearethefaces.abcardio.org, because there's a plethora of infographics and one.
Is that linked in your bio? Should they just click on your page and it'll be in your bio?
It will not be in my bio, but it will be in one of my posts.
It'll be in one of both. Okay, I tell you what, we'll put it in our caption.
Absolutely.
Because we'll post the replay.
Absolutely.
So We Are the Faces is the campaign.
We're the basis
with the American Association of Black Cardiologists?
With the Association of Black Cardiologists. And then the more recent work with the American Heart Association is really, as mentioned, trying to have more of a collaborative approach to maternal health, and mainly in that postpartum window. Because when we think about where the majority of deaths are occurring, it's from 7 to 365 days after delivery. And don't realize that. A lot of times there's interruptions in healthcare. We know that, but we also know that a lot of times moms, after they see their obstetrician and they're given the clearance to say, oh, everything looks good, they may not see a doctor until the next pregnancy or several years later, right? So as a result of that, what our initiatives are really trying to push forward is that there's an appropriate handoff for some of these women that are at higher risk, meaning once they're
seeing a cardiologist,
once they feel, the obstetrician feels that they are no longer necessarily requiring their care, they hand the patient off to a primary care clinician and potentially a cardiologist as well, depending on.
That is really important, because I think most women don't realize the risk postpartum is just as great, if not greater, because more people are dying, more women are dying post-birth, right? In the postpartum window, because of that gap in when they're seen, when the baby is seen, but are they seen?
Exactly.
Right?
Exactly.
It's such a very important information. Okay. So I noticed that your postpartum care recommendation list that you posted about, right? You mentioned to new moms, a new mom's health should be monitored for 12 months, which you just mentioned, yet many women don't get more than 4 to 6 weeks of maternity leave. What does this say about our system in your thoughts?
Yeah, I mean, as we sort of alluded to, our system is very, very flawed. We know that it's so challenging to get to the doctor's office, particularly in that fourth trimester, which is usually the 12 weeks after delivery. But then if your risk is up to a year, the hardship of potentially having to take some time off to make sure you're going to the doctor's office. And for this reason, a lot of the work that I mentioned through the American Heart Association is trying to ensure that we are advocating for either both extension in maternity leave, but also even many times in the United States, these women don't have coverage up to well.
Yeah. I think Medicaid was just extended to a year postpartum because of this, right?
It was, but not for every state.
Not for every state.
I'm happy to see that there are about 48 states. So we're really close to 50, right? We still have states right now that are sort of pending that extension.
Who is it? Shame them. No, I'm just kidding. Who are the states that are, who's pending out there? Who's pending?
But I'm hopeful that
Florida one of them?
It is
Florida one of them.
It is not, but I'm very hopeful that all states will extend it to 12 months. But it's a matter of not just having coverage, it's a matter of having actual quality care as well.
Right. That's correct.
And that's the most important piece that we're trying to push for.
You know, I do some work with Health First here in New York, and they're a large, health provider. And one of the things that they did a study recently where it was great. They provided wraparound services. They wanted to see what the increase in terms of percentage rate, how it would the outcomes would be affected with women having transportation provided for, maybe childcare provided for. Removing the barriers to them going to the doctor for their visits. And it was, the change, the increase was tremendous in terms of the impact it had, because sometimes it's the wraparound services, right? Because of barriers to care, right? It's like, wait a minute. Now I may have issues with, the Uber will take me. Maybe I don't have a car. Maybe it's about transportation to the doctor. Maybe it's about, the care. I have all these other factors. And I think that's all part of health equity, right? Health equity is that we all have what we need, and understand how do we, like, if you go back to how, that's why when people say, well, slavery, that was so long ago. What does that have to do with anything? Well, it has to do with generational wealth. It has to do with the large gap in the disparities and how we're being treated and what we have access to, right? What do you feel about that?
No, I completely agree with you. And I would even take it a step further. So yes, generational wealth is such a key factor, but that also trickles down to generational health, right? Because if we don't have that equitable health care, it's going to impact our overall health outcomes. And I think what many people don't realize is that 80% of our health is dictated even by our zip code, right? So where we
social
live,
determinants,
those social
absolutely.
Determinants, right? But where we live, what our zip code is, really dictates the amount of care that we are able to receive, but also that quality of care. And that's the most important key factor. So I encourage
modern day redlining still present,
unfortunately, but I encourage people to be mindful of that and work with healthcare professionals that are actually screening for those things within ourselves, because that is probably one way to help to decrease the outcomes that we're seeing.
So unpack that a little bit more. Give me more information on that. Share more on that. When you say screening for those things, what would that look like?
So it's not routine often that when we see patients, we're asking about what is your access to, let's say, a safe location to go out and walk, or even do you have the going to the gym? What is in your neighborhood when it comes to food? Are you living in
contextualizing the care?
Exactly. But really having that one-on-one conversation with the patient so you necessarily understand what they have access to and what they don't. What are the limitations? And are those limitations the reasons why their health is at their current state? And what can we as healthcare professionals and as a healthcare system, what can we do to help? And there are some things that can be done, but I, of course, am empathetic to the fact that it's more of a system approach that, of course, does require lots of change. But the more we advocate for it, my hope is that we will have that change eventually. But making sure that your healthcare professional is aware of what your limitations may be or what limitations you may not necessarily have is going to be a key factor, because those are just as important as knowing other things about your individual health as well.
It's really having the full picture of the patient that you're dealing with, right? It's knowing that I can't treat you the same. I can't look at you and say that your circumstance without your circumstance in terms of the impact it'll have on your health and the recommendations that are realistic, right?
Exactly.
Are these realistic recommendations? What's realistic for you, right? Have you heard of the Earth app? And if so, what are your thoughts about it?
I have not heard of the Earth app. What's the
Earth? My goodness. Okay. So the Earth app is, I'm actually on the advisory board for this app created by Narrative Nation. It's a nonprofit that looks to disrupt bias in the birthing continuum. And it's for B, it's for birth without bias, right? They remove the B for bias. And it's IRATH app. And oh my God, they've won so many awards, et cetera. She was just on Tamron Hall today, the founder of it, Kimberly Seals Allers. But what they are is like a Yelp-like app for ratings and reviews that congregates ratings and reviews for perinatal, obstetrician, GYN, hospitals, pediatricians up to a year of the service that you receive, the care that you receive from these providers, right? And they can be, because you think about it, we will look at reviews for everything from buying a car to what restaurant we'll go to, right? But when you look at the doctor reviews, they're not talking about dismissed your pain because you were a Black woman, right? Because typically speaking, the reviews are based on white women's experiences, meaning, right? So it's like, wait a minute, they didn't believe me, right? That they looked at me in judgment because they assumed that I was a single person, a single mom or whatever. And one of the number one things that always comes up is dismissed my pain, right? And how that can lead to so many negative outcomes, right? So what Earth did, I call it like the modern day green book, that in civil rights times, they created something called the Green Book, where you had to know where it was safe for you to go to the hotel, where it was safe to eat, where it was safe to go get gas, right? As Black people.
Yeah.
Well, we need to know what doctors are safe, what are not, what hospitals are safe, what's not, right? so that we now have contextualized care, reviews, and data, and then they turn around and use it now to help and work with the hospitals and the physicians, et cetera. But also for us finding, okay, wait a minute, what is the experience with that doctor? How can I find a doctor that's not just a good doctor in terms of they're board certified and they have the skill set, but they look at me as a human being and are going to treat me as a whole person, right? So that race factor that we talked about, the racism factor, is navigated with open eyes. So I think it's brilliant in terms of a tool for us to use, because then now I'm learning from, oh, wait, if I wouldn't turn around and go to that restaurant because they said, oh, they treat you poorly or the food is bad, right? I'm like, wait a minute, why? I need data on the doctors that I'm literally putting my life in their hands and my baby's life in their hands.
I was going to say, I'm going to research the app a little more, but it sounds phenomenal. I think that our goal right now is to make sure that we do provide these patients with tools to determine who is the right physician, who's the right member of the team, right, to be added to the tribe that is going to be getting you through the pregnancy and beyond.
Yeah.
There is data, which I do want to highlight, that supports that oftentimes Black women in particular feel more comfortable with Black physicians. But it's not about the comfort, because there's real data that shows that
that's real. What's it called? It's called, what is it? Ethnic concordance, right? Yeah. It's real data. Like there's research around it.
There's
outcomes too.
And lots of outcomes. But the challenge is that there are not enough Black physicians out there. And, you know, as a Black female physician, I only make up 2% of the population. So this is why getting my face out there and having people see that this is the true face of what a physician, what a cardiologist looks like is really important.
Thank you.
But
thank you.
Oh, definitely. But I think for, you know, the women out there thinking about pregnancy or currently in a pregnancy, it's really important that you do your homework.
Absolutely.
You know, I tell my patients when they come to the doctor's office, they should come prepared. Just like when you are going to your accountant during tax, right? You come with questions, come to the doctor's office with questions. And if the doctor is dismissing you, not answering your questions, if they're not necessarily giving you the time or day, then that's when you have opportunity to find someone else. Exactly.
I always say there are two experts in the room. I say this every time. You go to the doctor. Remember, there are two experts in the room. There's the doctor who's the expert in their field, and there's you who's the expert on yourself. And if they dismiss your expertise, I'm out of here. You know, they cannot diminish your expertise. And then sometimes some people are afraid and they're not, you know, they are intimidated, right? And that's why I would say bring an advocate with you. If you can't bring someone with you, have them on FaceTime. You know, you have the right to have support. You have the right to have support over and over. I have to say that. And, you know, the important thing is we want to learn from the living. We don't want to wait for somebody else to become a statistic. Let's learn from the living. That's why those ratings, reviews I mentioned are so important, because if I found that somebody's experience with that doctor as a Black woman, that's a red flag for me.
Absolutely.
You know what I mean? That's a red flag. And it's sad, but that's the system we live in. The system is broken. And we don't want to close our eyes and act like, oh, you know, we're Pollyanna. Yeah, la, 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 it's beautiful. No, it's not. It's broken. And the only way to win is to operate with that knowledge and the wisdom and the support that you need to win. So, final words that you want to share?
I just want people to not be fearful of the things we discussed, right? So this for your own empowerment, for your own knowledge.
You have power.
You have power, exactly, because we want to make sure you have a safe pregnancy, a safe delivery, and then beyond. And I think that beyond piece is the most important aspect. So the take homes that I would suggest would be, if you haven't seen your physician or clinician, you need to do that. You need to know those numbers. You need to consider, as mentioned, getting a blood pressure machine and maybe some other tools, but figure out what's normal for you when you speak your physician and your clinician. And then that is going to probably lead to better outcomes for yourself and your family.
Absolutely. Thank you so much, Dr. Rachel. This has been a great conversation. I hope it'll be the first of many to come.
Absolutely.
Let me make sure we didn't see if there were any questions. Do you see that question? Do you have any idea regarding hypermesis dravadian? I don't even know what that is. Do you know what that is?
I think there it was probably a little bit of a typo, but yes, hyperemesis gravidarum, which is probably a better question for an obstetrician. But what it is when usually during the early trimesters, you have intractable vomiting and nausea.
Ooh, I've heard of that.
That is an extreme version of morning sickness. And I would be remiss to answer as a cardiologist.
Right.
So I probably suggest that if you are going through that, I'm so empathetic for you because I know it's very hard, but it may be best to discuss with your healthcare professional.
Absolutely. Someone said, I had this experience when I gave birth. They were talking about preeclampsia a few months ago. Almost died twice, had to have a blood transfusion, uterine fibroid embolization, and blood clot removal. Almost had a stroke. Wow. After birth. That's a lot.
That's a lot.
You are a miracle. Wow. What is, when it comes to a stroke, and the connection, because you mentioned we're at greater risk for cardiovascular occurrences. Yeah. Because I know that's blood clot is one of them. When he talks about the 5 things, there's BP pressure that are high risk during birth. Right, during or right after birth. Where does a stroke land in that, and what are the risk factors? What could that look like in terms of identifying, the symptoms? Yeah,
that's a great question because there are several things that could lead to stroke. One, as you mentioned, high blood pressure, and that is what we often fear when it comes to preeclampsia, because when preeclampsia begins to have severe features, when other organs become involved, like the brain, we worry about seizures, we worry about strokes, because that elevated high blood pressure, of course, is going to impact the amount of blood that gets to those vital areas in our brain, just like it could impact our heart as well. Sometimes it can cause the heart to become weakened. And then as a result of that, the heart's not able to push blood out to the rest of the body. Signs when it comes to strokes that we have to take very seriously include slurred speech, if there are portions of our face or even our extremities that we're not able to feel anymore, or we're not able to move anymore. If we notice, or our family notices when we're smiling, that there's drooping, right? That there's some drooping of our actual side of our lip, those are dangerous. And that's when you call 911 immediately to get to the emergency room. And I think it's important to also bring up that there are other emergencies like heart attacks as well, right? Because there are common signs that people think about. The classic one is an elephant sitting on your chest, where it's high amount of pressure. It can cause a discomfort in your left arm, and then it could extend to your neck, and then it can make you feel nauseous and very sweaty. But what's really important to highlight is that for both stroke and heart attacks in women, the symptoms are more subtle. So as an example, for stroke in women, sometimes it could just be confusion, where they're a little bit off. They have a little bit of brain fog. Maybe they feel a little dizzy and imbalanced. That's very concerning if that doesn't go away, and seeking medical attention right away is important.
Yeah, because that could feel like hormonal imbalance. That could feel like so many things.
Exactly. And even when it comes to heart attacks, fatigue, which similarly hormonal imbalance,
right?
That often a red flag that there could be something brewing. So this is why,
if you were monitoring your pressure at home, would there be a difference in your numbers if you were experiencing that and it wasn't related to, something like, how would you distinguish that wasn't just like, oh man, it's connected to hormonal imbalance versus, this could be a cardiovascular event?
So this is why seeking medical attention is important, because it's extremely hard for somebody who's not in the medical or has that experience to differentiate.
Just don't ignore it. Don't ignore symptoms.
Ignore it, especially if those symptoms don't go away, especially if you know you have risk factors. So as you mentioned, oh, wow, I'm not feeling well. Let me check my blood pressure. Oh my goodness, my blood pressure is extremely high. It's in that 160 over 110 or greater range.
Don't ignore it.
Don't ignore it. You have to go seek medical attention right away, because the likelihood is that is what's causing your symptoms, and that potentially could be causing heart issues or brain issues in the setting of a stroke.
And heart issues can lead to brain issues, I mean, like right away. So that's really important. Dr. Rachel Bond, everybody. Amazing. Black, can I just brag on you right here? Black female cardiologist.
Absolutely.
Y'all love it. So follow her. And, we'll post this replay so you can share it with all your sister network, because every single person you know needs this information, because we all have hearts and we all do not take care of our hearts the way we need to. We all need to level up our heart love. Okay. So thank you so much, Dr. Rachel. We appreciate it. And we look forward to more conversations. Thank you for spending your time with us today. And we're just grateful.
Thank you. Have a good one.
You too.
Okay, bye-bye.
Oh my goodness. I appreciate you guys. Thank you so much, everybody, for being here with us. I'm going to let me see. Okay, there you go. Thank you so much, everyone, for being with us today. This was very vital information. As you know, if you didn't hear it, you definitely want to listen to the replay, but it's close to 60% of Black women are dealing with some sort of heart condition and don't know it. Many high blood pressure. And don't know it with it ages 20 and up, we're talking about. So we're not talking about an older person's disease. We're talking about vibrant young people. And most likely, there are a lot of factors, and stress is one of the major ones. And many of us are not dealing with stress properly. So we want you to know the opportunity, 80% of it is preventable. The opportunity here is we have so much power. You need support. Please don't suffer. We want to help you. Our team is here to help you work with your physicians, help you to navigate just getting to the vibrant and abundant health. Okay. Please take our free quiz at thedetoxnow.com /quiz. If you just go to the website, thedetoxnow.com, if you're dealing with heavy cycles, you're dealing with period pain, you're dealing with high blood pressure, we want to help you to have those conversations with your doctor, also equip you with what you can do specifically in partnership with the plan that your physician may be recommending specifically to ameliorate your symptoms, to feel better, to take control of your health. You have so much power. And we are here to help you with that. So decide today, I'm going to prioritize my health. I am going to seek out the support and the help that I need. We've got tons of it for you. Visit us at thedetoxnow.com. We love you.